As the number of patients recovering from the coronavirus continues to increase, doctors on the front lines are facing a new medical mystery linked to the virus. With more and more data pouring in, cardiologists have found that in addition to lung damage, many COVID-19 patients are also developing heart problems and dying of cardiac arrest. For more on this, CBS News senior medical correspondent Dr. Narula joins me now. Hi, Dr. Narula. Can you first tell us, how does getting infected with COVID-19 impact the cardiovascular system?
Well, we're just beginning to learn about this. And we have to remember that this is a virus that we have data on for only several months. And what we're starting to see is that we're not sure if it's the virus itself that is causing potential damage to the heart, or if it is that immune inflammatory response that's responsible. But we've seen a couple different things when it comes to the cardiac system. We have seen that this can mimic a heart attack, so people can come into the hospital and have blood tests that show heart damage, but when they're taken to the cardiac cath lab and we look at their arteries are actually without blockages. We've also seen that it can cause something called myocarditis, which is an inflammation of the heart muscle that potentially could lead to heart failure, and also irregular heart rhythms or arrhythmias. So there are several different things that we're seeing when it comes to patients who are coming in with COVID-19, which tells us that we really need to study these patients. We need to study them for a longer period of time so we can see what the long-term consequences are and what treatments they may need to be on in the future as relates to their cardiovascular system.
So does this complicate matters in terms of the symptoms people should be looking out for? I mean, does this now mean there are other potential COVID-19 symptoms we should all be paying attention to, even if perhaps we aren't running fevers or coughing?
Well, one of the symptoms of COVID-19 we've talked about is shortness of breath. And certainly when it comes to the cardiovascular system, shortness of breath, as well as chest pain, which we can see in COVID-19, can be signs of a cardiac problem as well as related to COVID-19. So, I've had patients call me, in fact, in the last several weeks, and say that they're having shortness of breath and chest pain, and they have underlying cardiovascular disease, and it's unclear. Is it really the COVID or is it their own underlying disease? So it can complicate the picture. Anytime anyone has shortness of breath or chest pain, though, these are symptoms that we do need to take seriously, that we need to have evaluated. And the question of really how to evaluate them, whether that's in an office setting or in the emergency room, because of everything we're dealing with, it becomes the critical question. But no doubt, I think for any patient that's experiencing that new chest pain or shortness of breath or feeling like they're going to pass out or fatigued, these are things that should prompt them to call their doctor and have a discussion about what the next step should be.
So then what if you're experiencing those traditional symptoms of a heart attack or a stroke? Should you go to the emergency room right now, or are you increasing your chance of infection, to COVID-19 if you don't have that?
And that's a great question. And again, this is real life. I had a patient call me last week who had chest pain, and I told her, given her history, she probably should go to the emergency room, and she was scared to go. And this is reality for a lot of people, that they're more worried in some cases about getting infected with the virus than potentially what might be happening to their heart. So I think we've definitely seen, when you look at the numbers, a downtrend in the number of patients going to the hospital with chest pain or rule outs for heart attack or even stroke or heart procedures that we typically would do. And the question becomes, why? Is it because people are really at home riding out their symptoms quietly and silently, which is not a great thing if it ends up leading to a heart attack or a stroke, or is it that there's something that's changing, that we're just seeing a downtrend in those particular diseases, which is really probably less likely. But I think the fact of the matter is, when it comes to things like heart attack and stroke, these are conditions where time is important and critical. And once those heart cells and brain cells die, they cannot be regenerated. So, we don't want to take chances when it comes to anybody who might be experiencing symptoms that could be concerning for either a heart attack or a stroke. That is something that should prompt you to speak to your doctor and potentially to go to the emergency room, even if it means you might be risking infection.
And doctor, we know that there are some drugs such as hydroxychloroquine, which are not approved yet for treatment of the coronavirus, but that a lot of people are turning to. How do drugs such as that one and others impact the heart?
Again, this is something that we're really learning about. We know with drugs like hydroxychloroquine and azithromycin, as an example, both of these drugs separately and individually change the electrical conduction in the heart, and they cause something called a prolonged QT interval, or can cause that. And for people who may be susceptible to arrhythmias or some electrical problems, that could be not so great for them. And what we know is that when you use these medicines in combination together, that arrhythmic effect may even be worse. So, we need to be studying these patients in a trial situation, really looking at what is the benefit in terms of COVID-19, but also what are some of the side effects when it comes to the cardiovascular system and heart rhythm issues that we might be seeing when we use some of these drugs as an off-label or a different use than we're typically used to using them.
Dr. Tara Narula, thank you so much for joining us and sharing with us your expertise on this subject. A lot of people have a lot of questions right now about the coronavirus, and we know a lot can't be answered, but we, appreciate your medical guidance. Thank you so much.
Thank you.